let's talk about kind of the two main things about this case are puberty blockers and hormone therapy. What exactly are those things?
Yeah, let's jump in. Okay, so let's start with puberty blockers. Puberty blockers are a medication that temporarily halt the kind of physical changes that occur during puberty. So they work by suppressing or slowing down, your body's production of sex hormones like estrogen and testosterone, which are responsible for the development of those kind of sexual characteristics that are unique to both men and women. So, breast, facial hair, body hair, your voice deepening, your muscle mass. Think of all the things that happen during puberty, and blockers are essentially putting an unhealthy pause on these factors. Now, one thing I'd love to add is that a lot of times people are told that puberty blockers are reversible. However, that's actually quite foolish because there's a lot of the long-term use of puberty blockers can affect your bone density, how your bones are structured, your height, and those are just not things that you can go back and change after puberty. So, when you hear from a lot of detransitioners, they talk about how, maybe they're able to carry a baby now, but their bone structure, their hips, are not able to actually allow the child to be born correctly. Or, their facial hair, unwanted facial hair and voice deepening that sometimes taking estrogen again can counteract, but it's not reversible in the way that they lie and say it is.
Yeah. And it also won't be how, even if you reverse it, or it won't be how it was originally intended to be. So the
Yeah.
characteristics that just make you uniquely you will never be the same, unfortunately.
Yeah. So puberty blockers are in essence a pause, even though, we know you cannot perpetually pause age without these immense side effects.
And then what exactly is hormone therapy?
Yeah. So hormone therapy. So puberty blocker on the one side, right? Blocking puberty, pretty straightforward.
Yeah.
Hormone therapy, also known as hormone replacement therapy or HRT, you'll hear that term a lot. Oh, I'm on HRT, is kind of the proactive step of administering wrong sex or cross sex. You'll hear both those words, hormones. So, what that looks like practically is for men, they're given estrogen, which is a primary hormone used to develop more kind of feminine characteristics, right? Such as breast. It's moving around your body fat, softer skin. And there's also certain medications for men that are used to block testosterone as well. So it's the blocking of testosterone and the increase of estrogen for men. And then for women, the primary hormone is testosterone, right? This is, to induce more the masculine characteristics, the facial hair, the body hair, your voice deepening, the increased muscle mass. And one thing that's really interesting is that for women specifically, a lot of people that are struggling with gender dysphoria are, it is a mental illness, and they're also often struggling with other mental illnesses like depression, suicide ideation, and, the list goes on. What's really interesting is that when women are given testosterone, and I always slur when I say that word, so I'm sorry.
No, you're good.
When they're given that drug, it usually helps their mental health issues at the beginning, right? Because testosterone increases your confidence, increases your sex drive, increases your ability to gain muscle mass. So often when women go on testosterone, they're given this kind of false high of like, oh my gosh, I feel so much better. And it's very confusing at first because suddenly they go on it and they're kind of like affirmed in their feeling that it was a good thing to go on because testosterone does just increase your confidence and your drive. And so that's kind of like an interesting factor of that. Now, some side effects. Is that okay if I go into some of the side effects?
Yeah, please do.
Okay, great. Before I hop into some like known side effects, I want to be very cognizant that there are just so many unknowns. There are so many things that are untested, unverified, because this is so new, right? Like we are experimenting on our children. So, while we have some things and some knowledge on the side effects of these puberty blockers and these hormone therapy, a lot of things are just very unknown and doctors don't know what to do with these detransitioners. So just hold that as we talk about the rest of them, that there is just so many unknowns, that so many effects that we can't really, understand. But one of them very clearly is fertility. Um, hormone therapy can affect fertility in both men and women differently. Women taking testosterone may become just infertile, and men taking estrogen, it may, decrease their sperm production. Now, puberty blockers are started at, you guessed it, like puberty, duh. And that's a really young age. Many minors might not think about childbearing, or do I want to be a mom? Do I want to be a dad? Do I want to be able to have my own biological children? Is it going to be harder for me to carry? Is it blah, 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 and the list goes on, right? So a lot of these effects of fertility are just not even asked about at that age, and are not informed. And parents and kids cannot consent when they aren't told the risks. So that's something that we have to be really aware of, is that like they're not being told how this will affect them. So it's incredibly sad. Some other side effects are
Can
mood
I
changes.
ask a quick question?
Yeah.
Do people take puberty blockers and hormone therapy at the same time? Is that a thing that happens?
I
Or
believe,
is it one or the other?
yeah, it's a good question. I believe it's puberty blockers and then hormone replacement therapy,
Okay.
but I think they can be a little bit side by side.
Okay. Sorry, go ahead. That
No,
was going in my head and I was like, let me ask before I forget. Go ahead.
that's a
Sorry.
great question. No, yeah, just a few other side effects are mood changes. Women when they go on testosterone can have some like aggression issues, and it's just your body as a man or as a woman is not supposed to have those levels of cross-sex hormones in your body.
Yeah.
So it's changing your mood. A lot of weight changes, specifically for women when they go on testosterone, acne, headaches. Those are just like some smaller ones, but then there's some more serious ones of blood clots and heart disease and liver damage, and yeah, the list goes on. And it's truly very heartbreaking when you're talking to kids who have been put through this. Of the constant refrain that you hear, Mallory, is just, "I was never told what would happen to my body," and that is, as adults, we should look at that and go, these children didn't know. They can't consent to something they don't even know. They're not told about. So.
Yeah. And I think the part to me that's like just so strange about doing it so young, especially, is what you want at 9 is so different than what you want at like 29.
Oh my God.
You have two different wants. I mean, not only that, but like you're not thinking ahead. At 9, I do remember wanting to be married and having kids, but I didn't think ahead of like, okay, if I am going to have kids, am I going to send them to a Christian school? I went to Christian school. Am I going to send them to Christian school, or am I going to homeschool them? And if I do send them to Christian school, that means I probably need to make a decent amount of money. I probably can't just do my, little jewelry and baking at home. I probably need, and if I do, I probably should marry someone who has a nice family. You're not thinking it through at 9 years old. So something that's so like your body, and it's your only body. You don't get another one. That's the other part that's really, you don't get another one.
Well, and that's the thing too, is that like the overwhelming majority of children will grow out of these feelings, right? It'll naturally resolve their gender dysphoria as they mature, and intervening is just catastrophic, right? It's like they're going to naturally grow out of it, the large majority. And now at this small little sliver of time and space, we're going to literally, for their life, change their body, change their health, change their outcomes of how they can live their life.
Mm-hmm.